Assalamualaikum and very good day, madam. My name is Wan Nurdina Atirah binti Rosli from Bachelor of Medical Imaging, cohort 18B. My student identification is U62300108. Today, I would like to share my case study that I choose, which is infertility. But infertility is too general, right? So let me give a very specific subtopic, which is mechanical tube occlusion device and bilateral fallopian tube blockage. In my right, we can see the table of contents in this case study. First, I have the introduction, which is anatomy of the part and explanation about the indication. Second, I have the procedure, which is include patient's details, preparation of patient before examination and equipment needed. Third, patient care during examination. Fourth is radiation protection that must be applied. 5 is explanation during procedure and post-procedure. 6 is image analysis, and last but not least is summary of this case study. Let me tell you about fallopian tube blockage. Fallopian tubes are female reproductive organs that connect the ovaries and uterus. Every month during ovulation, which occur roughly in the middle of menstrual cycle, the fallopian tubes carry an egg from ovary to uterus. Conception also happens in the fallopian tube. If an egg is fertilized by sperm, it moves through the tube to the uterus for implantation. If a fallopian tube is blocked, the passage from sperm to get to eggs, as well as part back to the uterus for the fertilized egg, is blocked. Common reason for blocked fallopian tubes include scar tissue, infection, and pelvic adhesions. Okay, next is anatomy of the part. I highlight the important anatomy, which is first is uterine tube, second is normal contrast pill into peritoneal cavity, third is body of uterus, and last but not least is speculum. In your right side, madam, also have the full anatomy part of reproductive system. Okay, now I would like to tell you why doctor wanted to do this procedure on this patient. Here are some explanations. Mr. Sunil and Mr. Janagi visited Dr. Pallavi at Nova IVF in Seremban. The couple had been married for 6 years and visited Dr. Pallavi with complaints of infertility. The couple was concerned that they could conceive despite being a normal couple with no medical conditions. After taking a true medical history, Dr. Pallavi advised Mr. Sunil and Mrs. Janagi to undergo a fertility assessment. The tests were aimed to evaluate Mrs. Janagi's capability to evaluate her tubal patency and health of her uterus. The couple did not face any difficulties having sex. Mr. Janagi had a history of whitish vaginal discharge 3 years back and was treated using vaginal tablets. To evaluate Mr. Janagi uterus and fallopian tube better, Dr. Pallavi advised on hysterosalpingography, which is HSG procedure. Okay, next, basically this is a form that patient will get before the procedure start. She need to fulfill the question about herself. The question in the form are her name, which is Janagi, anak lelaki Kumar. Date of birth is 21 January 1988. Her first day of period is 7 February. How many days are in her period is 10 days. The flow of her period is heavy. She is not had an unprotected sex since her last period. She is not pregnant. She is not had a pelvic surgery. Her husband had already been checked for sperm count. She is not taking any fertility drug. She is not taking any birth control pills. This is her first time to do hysterosalpingography, which is HSG. And last but not least, she did not have any allergies to contrast and such as seafood. Next, I will continue what is the patient preparation need to do before the examination start. First is a course of antibiotic may be prescribed prior to the test depending on patient referring provider's recommendations. Second, patient can eat and drink as per usual the day of the test. Third, tell patient take ibuprofen several hours prior to the test to decrease possible discomfort. Fourth, if patient have additional questions about the exam, consider discussing additional pre-medication options with their referring doctor ahead of time to bring to the appointment. Fifth, if patient take an anxiolytic, please arrange for a ride to and from appointment. Sixth, patient will be given a contrast screening form to complete. 7. Patient will be asked to change into a hospital gown before the procedure. And 8. The doctor will verify patient identification and exam requested. So, this is all the equipments that used in HSG procedure. The most important thing is of course we need fluoroscopy machine. Second is Valsalem forceps and vaginal speculum. Also, this is the equipment that is used in this procedure, which is uterine cannula, Leach-Wilkinson cannula, and the HSG tray. Last but not least, tenaliculum and scoridotensculum, straight and double tooth are the equipment that be used in this procedure. Me as a radiographer or others radiographer, I have to be more focused on my patient. So the patient care that have to take note during procedure is such as maybe she think that she is pregnant or not pregnant. Second, when doctor do the procedure, patient currently have pelvic infection. Third, I have to ensure that patient did not have any allergies or adverse reactions to medications or iodinated contrast material. Fourth, I have to inform patient to leave their valuable item at home. And lastly is inform patient to bring a list of her current medication with me. As a radiographer, radiation protection is important when we do the procedure or examination, especially HSG procedure. I have to make sure all the staff in fluoroscopy room, such as doctor and nurse, are wearing a leg gown and thyroid shield. Also, I have to put a shielding on patient too, but not obscure pelvic area. Next, we go to how is actually the procedure looks like. First, patient need to lie on the fluoroscopy table. I will put the cassette behind the patient body or using the fluoroscopy to take an epi-scout image at the pelvic cavity. After take a preliminary film, position the patient in lithotomy position to take another image using the contrast media. Doctor will put speculum to be inserted in the vagina. It holds the walls of vagina apart to allow the cervix to be viewed. The cervix is clean and at the end of the procedure may be injected with local anesthesia. One of two methods may be used to insert the contrast media. Speculum is then removed and patient is placed in a slight transilebar position. Shrink filled with contrast media is attached to a cannula or balloon catheter. Care must be taken to expel all air bubbles from shrink and cannula, as this will cause confusion in interpretation. Contrast medium is injected slowly into uterine cavity under intermittent fluoroscopic control and image will be obtained. So what I'm going to tell you is what have to be done after procedure. If patient are going home, she may resume her normal activities. Second, patient may experience vaginal spotting bleeding and pelvic cramps for 1 day after the procedure. Third, Tylenol or ibuprofen, previously tolerated pain control for menstrual cramps, may be taken as indicated after the procedure for pain relief. In some instances, patient may be prescribed an antibiotic after the procedure. If patient experience increased pain, fever, or having bleeding after the exam, contact her doctor immediately. Next is the image analysis. Basically, what we will see during procedure and after procedure. So, intercornual diameter, the diameter between the cornua of uterus, and interiliac diameter, the diameter between lower ends of the right and left iliac bones at level of sacroiliac joint were measured, and ratio between intercornual diameter to interiliac diameter was determined. The HSG measurement of the normal uterine cavity size as a ratio of the cornoiliac diameter is illustrated in right picture. For the second picture, hysterosalpingography study revealed non-opacification of both fallopian tubes with no evidence of peritoneal spillage of contrast medium, extensive intravasation of contrast into the myometrial and ovarian vessel, normal endometrial size, shape and outline with no persistent filling defect. Next, I will explain the diagnosis of this procedure. Here is 3 diagnoses, which is laparoscopy, ultrasound, and HSG. First is laparoscopy. Laparoscopy is a minimally invasive surgery that allows doctor to see inside her abdominal cavity. They make tiny cuts into her belly and insert a small camera laparoscope inside to take a closer look at her fallopian tubes. But when doctor do the ultrasound, her fallopian tubes are usually visible on ultrasound. But if they are swollen because of fluid build up, they appear larger than usual. Sometimes they be shaped like sausage. And last but not least is HSG. HSG is test to check for blockage in her fallopian tubes. It's the most common test used to diagnose hydrosalpingography. Doctor will insert a dye medium into patient uterus and watch its movement via X-ray. Now is end of this procedure. So I will give the conclusion about this procedure. Tubal block can occur at different parts of the fallopian tube. The most common are at the cornual end and at the fibril end. When there is a block at the fibril end, the tube can become distended, which is swollen, and this is called hydrosalpinx. Hydrosalpinx may be diagnosed by ultrasound or hysterosalpingography. hysterosalpingogram. Hydrosalpingo are usually asymptomatic and do not require any treatment unless the patient is keen on pregnancy. So this is my reference. That's all from me. I hope that now everything is clear about this procedure. Thank you.